Rickets. Introduction. Which of these can be weakened if you do not get enough vitamin D?
Choose one of the following options.
1. Bones. 2. Muscles. 3. The immune system. 4. All of the above. Correct. Vitamin D is a vitamin that the body needs to stay healthy and maintain strong bones. Rickets usually happens when a child does not get enough vitamin D. Select true or false. Correct. Rickets usually happens when a child does not get enough vitamin D. There are many different causes of rickets. It can also be inherited. Wendy has noticed that her son Henry is growing slowly. He developed bowed legs after he started walking. Henry says that the bones in his arms and legs hurt. Should Wendy take her son to his healthcare provider? Select yes or no.
Correct. Delayed growth, bowed legs, and bone pain are symptoms of rickets. Wendy should contact her child's healthcare provider right away.
Having dark skin increases your risk of developing rickets. Select true or false. Correct. Dark skin does not react as strongly to sunshine as lighter-colored skin, so it makes less vitamin D. The deformities caused by rickets usually improve or disappear if your child is treated while they are still growing. Select true or false. Correct. If rickets is treated while your child is still growing, the deformities usually improve or disappear. A baby can get all of the vitamin D it needs to prevent rickets just from breast milk. Select true or false. Correct. Because human milk contains only a small amount of vitamin D, pediatricians recommend that all breastfed infants receive oral vitamin D daily beginning the first few days of life.
Thank you for using Explain.